in terms of the inflammation, let me ask you this.
Mhm.
With your personal experience and what you have seen over the years, what we look for is what affects our patients, right? So
Yeah.
let me ask you, in your clinical experience, in terms of your epithelial, your lymphoid tissue, and as you indicated there, your phases of inflammation, tell us a little bit about how your personal experiences with the immune system, how it's affected multiple organ systems.
The most, well, I first would like to start with the gastrointestinal tract permeability. I think that is like the most important thing, or like the thing that I get like encountered with the most. And the thing that I noticed is that in very old patients and the kind of like work that I do, there have been like enough and very important studies that link gut permeability and the stability of the tissues with a very prolonged length of stay, of intra-hospital length of stay. So that is one of the things that I think affect the people the most. The most time that they spend in the hospital is going to be like the worst, like they're not gonna have like any kind of improvement. They're gonna continue losing musculoskeletal mass, and it's going to be like it's going to be even harder to fight against infections once they start like getting in that kind of metabolic and nutritional state. So I think and I know that the provision of prebiotics and probiotics and this kind of patients is going to be like a big effect on them, and they're gonna get like a better outcome out of it. So yes, that's like one of the first things that we have to put into that idea. The other thing that I know that actually helps is that immunonutrition, and immunonutrition is one of the promoters of anti-inflammatory pathways that might help reduce that pro-inflammatory response that very ill patients are having. And maybe I'm talking about critically ill patients, but this can actually function in chronically ill patients. And I'm talking about cardiometabolic distress, or I'm talking about allergic reactions. I'm talking about every type of chronic disease. So yes, in that particularly set of things, immunonutrition, it's going to be like a big help out of it, but it's going to be because all of the immunonutritional foods are going to induce like a anti-inflammatory effect, and they are going to repair that tissue that it's going to be distressed by all of the diseases that are inside of the patient. So
I know as I go do that, what I like sharing here is that, let me go ahead and share my screen here, and you can actually see that when I look at what goes on when I see a patient, and as we've been able to work with patients, it may start out as an issue that it's a back problem, it's a knee problem, it's a chronic issue. And what we've seen is the inflammatory components don't just stop there at the knees. We're dealing with an individual, and what we find out that many times I'm dealing with an individual who's had multiple joint issues, maybe even replacements at an extreme, okay, or just chronic knee pain or chronic discomfort. Well, we are trying to make the connection here that it does rely upon the general state of the immune system and the inflammatory response.